Greetings, greetings. This is Perspecive Makma, live again from Meridian World News Studios in Hammond, Indiana. Welcome again to another episode of our weekly show. We took a brief hiatus last week, so we have about 2 weeks worth of material for you guys today. We're going to try to get through it pretty quickly. Before we get into our news, our other news, I wanted to make a quick statement on what's happening with the riots with George Floyd. The protests for his death, the riots, the looting, all of this is, really showing just how much this world is in trouble. How much this world is like people are just crying out for change. People are desperate for something different. And you see George Floyd becoming somewhat of an icon somehow of somebody who, represents all these people who, may not be perfect people, but feel like they don't deserve to be treated like animals. Like they don't deserve to be treated like property or like resources. So you're seeing the massive outcry of so many people now looking for change, demanding change. We need something different. We need things to be done. Many people are organizing. Many people are showing that they're ready for a difference. And the world is ready for a difference. It's clear. It's time for some changes to happen. Now, that being said, I'm really wishing amongst all the people who are crying out for change, want to make a difference in the world, please, let's be intelligent about it. Let's be strategic about it. Let's come together and be civil about it and figure out how we can stand on a common ground amongst each other. Our first video, or our first, the first topic we have to talk about. If you ever heard about the, Capitol Hill Autonomous Zone in Seattle, you should check it out. The people of Seattle have taken control, or let's say, not necessarily all people, but protest groups in Seattle have taken control over certain areas within Seattle itself. And they've called it the Autonomous Zone. Here's a headline from the New York Times to show where recently the Autonomous Zone, experienced a shooting. And in this Autonomous Zone, they're not letting police in. They said that they're going to police themselves. But then when the shooting happened, they needed emergency personnel to come. So the fire department came, but they were not willing to enter the area for at least about 20 minutes until, the police said it was safe for them to enter. So you see, there's this kind of, give and take. You don't want emergency services, you don't want the police, you also don't get the fire department, you also don't get the the emergency medical services. So it's interesting to see, people are talking about wanting to be autonomous. There's a big movement now talking about defund the police. If you're not aware, many indigenous societies all over the world have functioned, since times immemorial without police departments, without people having to tell them, without having armed people to protect them from themselves, essentially as a population. The idea of having police, a society of laws where people have to be policed in order to maintain, their or stop from doing the wrong things, basically. This is a relatively new concept in world history. But now we're in a place where, at least here in the United States, and, maybe to a lesser degree other places in the world, where people are used to it, used to having the police to rely on to call, and not really used to being able to rely on themselves for their own public safety. So recently as well, there was the Minneapolis, we shared this last show 2 weeks ago, the Minneapolis City Council had voted to disband their police department. I haven't received any news on that, whether that's actually going to happen. However, it's a question, and it's a big question, because not when we talk about being autonomous, self-sufficient, we're not just talking about um, the police. Being self-sufficient, being autonomous, is being able to provide your own food, being able to provide your own health care, being able to provide your own supplies for, building things, or your automobiles, or whatever technologies and that you're relying on. You need to be self-sufficient to be able to provide these things for ourselves. Right now, looking at the situation where we don't see ourselves being, comfortable having to rely on this system and its mechanisms for everything we need, it's become like where, you know, we have to question, do we have what it takes to provide what we need for ourselves? Right now, I say we're far from that. But if we want to make the change that we want to see in the world, we're going to have to build that self-sufficiency as well. And that includes being able to protect our own neighborhoods, as well as provide our own food and necessities. Um, we're going to move on. The next thing I wanted to talk about was, we recently, around the same time as these riots were taking place, one of my teachers, Naba Iritash and Mira from the Earth Center, he gave an interview on a UK podcast regarding the indigenous approach to coronavirus and what you can do, how we see it, within our communities, indigenous communities. So, without further ado, I'll just play the clip, and then we can talk about it after.
We shouldn't be putting this on the gods yet. We shouldn't be putting this pandemic coming on the ancestors yet. The gods and the ancestors, they live in their world. They live in their world, and I pray that they're not having this over there as well. But if we have to really be honest, apply spiritual honesty and intellectual honesty in this situation that our political leaders and scientific leaders put us, we have to really just blame ourselves, first of all, as human, because we allow ourselves to be led, to be trained, to be conducted as animals, to be tamed as the way you tame an animal. Because every human being that gets to walk on this planet has something great within that will tell you at some point this path is not good, even if this path is something that will put me in a comfort zone or will help me maybe achieve my ambitions or my individual ambition. At least I know this is not a good path, and we will find a way to go around it. But we didn't do that as human. We allow our leaders to feel powerful, our political leaders to feel powerful, our religious leaders to feel powerful, to the point where even our science to feel so powerful, to the point where, they keep working and putting in front of us and ahead of us things that will just keep softening the greater part of us as human beings. And most of the human beings nowadays are soft. Most of the human beings are soft in character. Most human beings don't even exist spiritually. Most human beings don't even exist spiritually. So with this situation, it's going to be so challenging to for the societies of law, meaning like the societies of law. For those who don't know what societies of law are, those are the societies of so-called developed countries. The societies of law will have to look back in their laws and change things, or it's just going to be like a bigger catastrophe that's going to come. And it's just sad that when this pandemic started, the whole West was more worried about Africa. All of the presidents of the so-called superpower countries, France, America, probably England, Canada, I mean, all of the superpower countries thought that Africa is going to be, you know, it's going to be bad in Africa, Western Africa. But that's really like not knowing what Africa is. Because if you know what Africa is and if you know what African spiritual leadership can do, you can now go forward thinking that way. But Katasa, this is the situation. That sickness is a or whatever they call virus. In our temple as a natural practitioners and healers and priests, after studying that sickness, what we end up finding is just a, we're not going to call it a virus. We're not going to call it a virus because it's almost like this sickness is almost like a combination of somebody who has a pneumonia and then who also has like a liver problem with uh, tuberculosis. Like when you put those three problems together, even for the science, we know that they're going to be watching and they will be trying to steal. They're not going to come humbly and say, how can we go forward fixing this? But they're going to be, watching us and then taking whatever they can take and trying. And once it works, they're going to go like, yeah, we found it, it's working. But they're not going to give us the credit, no problem. But this is the situation. When you put the tuberculosis, you put the someone who has a pneumonia, and you put the someone who has like a weak liver, you put those three problems in someone's body, that's it. I mean, you're going to suffocate. You're not going to survive. You're going to suffocate. You're not going to survive. So, simple ingredients, simple ways of dealing with this sickness. That here, I'm sure the reason why it's not really too big in Africa is because people have those kind of ingredients that they can use, and then they wake up every morning, they just use it. They do it before they go to bed, and they wake up and they're strong again. At the same time, when you look in the society, in the modern society, you have a big weakness: sugar. Sugar is the great corruption that the modern society's leadership succeeded, or even food chains and pharmaceutical companies and all of that succeeded. Sugar has become almost like the foundation of every or most of the Western people diet. And this is playing now. With a lot of sugar in the body like this, for sure, when you eat whatever you eating and then the sugar in it, yeah, you feel comfortable. It's nice. It tastes sweet. That's good. But at the same time, you're weakening your immune system. And that big handicap that you have coming from sugar is that the immune system of the people in the West, we really cry for you, to be honest. In Africa, we cry for you. We really pray that, you remain under the protection of nature because individually and collectively, the societies of law, the modern societies already expose or even let's say pre-exposed themselves to any pandemic or already expose themselves to any health problem to come, and instead of just taking 10 people, it's just going to take 1,000 people right away. Like any sickness that will come, even if it has to be global, and then come in an indigenous society of principles, and then take like one person. When we compare that with what that's going to take in the modern societies of law, they can take like 1,000. At the same time, it's taking one person in these kind of societies where principles are maintained. 1,000 will be losing their lives in the societies where only the laws are maintained, no principle is maintained. So this is the situation we find ourselves in, and how can we face it? Hey, you have to start facing yourself, your comfort, your comfort. You have to start facing that. Your immune system, you have to start thinking about how to build your immune system. If you already past 40s and then sugar has been like your your main food, I mean the main thing in your diet, understand that you already expose your children. And if you're a mother or father, know that you already expose your children.
So that's Naba Iritash and Mira, and he's providing some very important insight to the situation with COVID-19. If you're not following, you should definitely check out some of the numbers coming out of Africa. As he was just saying, maybe for every 10 deaths, there's already going to be 1,000 people dying in places like the United States for every 10 deaths in Africa. I think the numbers, even if you look at the numbers, are even much more, it's a much bigger disparity. Maybe like for every 10 people in the whole Africa, which is 1 billion people, you might have at least 1,000 or more deaths here in the United States, maybe even 10,000 more deaths. The numbers coming out of Africa really should force us to question really what is the difference between us here and them there, where suddenly this pandemic explodes, and all over the world you see, you know, Europe, Russia, China, Iran, Middle East, Brazil, United States, Canada, India, Australia, all these different places with huge numbers of cases, huge numbers of deaths. And yet in Africa, the whole Africa, even, you know, sub-Saharan Africa, you know, the same sub-Saharan Africa you always hear about as being the impoverished, war-torn, destitute, you know, third world place that people are scared to go because they don't know if they'll get, you know, if they'll be able to survive. They might get sick, or they might, you know, encounter whatever, you know, some unsafe situation. This is the place where, you know, you have the least number of cases in the whole world. And let's look, you know, we have on Google, you can pull this up, and everything that we're sharing today, you can pull up yourself. It's a quick Google search and you'll find it. This is actually a map from Google News, and you can see where in Africa and here in the United States, we're in the hundreds of thousands of people died. Now let's look at Africa. Let's look at Nigeria. That's one of the places that's, you know, commonly known. And here, I think, yeah, they have in Nigeria, they have it broken down by province, but in the whole Nigeria now, 518 deaths. We have in one city, you know, in one city in the United States, you might see that in one day. And this is for the whole pandemic period. Let's look at Ghana. That's another popular location. Ghana, still in double digits, 85 deaths. Madagascar was made some news last month about the fact that they came out with a COVID vaccine. I mean, not a vaccine, but like a herbal remedy At the time, they had 0 deaths. Now they have 15 deaths. Will we say now that their treatment is failing because they now have 15 deaths? I don't see why. If you don't say that, United States, obviously all these other countries are failing horribly if that's the case. Let's look at Zimbabwe. Zimbabwe, a couple weeks into the pandemic, approved an herbal vaccine that they can use domestically in their hospitals. 4 deaths. Okay. Let's compare that. Let's go look at Brazil. 50,000. Let's look at Iran. No, let's look at Mexico. That's closer. Let's look at Mexico. Because you're going to see all these places. Mexico is broken up by province. But it's interesting, 66 deaths here is Zacatecas. Some of these places in Mexico too, they have a very, they're very close to their original ways. They're very close to their natural lifestyles. And so, and if you look here, let's look at Florida. By comparison, Florida and 3,000. 3,000. Okay, let's go across the pond a little ways and look at India. $13,700 deaths. So, you can pull this up. This is like, updated daily, if I'm not mistaken. And you can look this up and see exactly how much this pandemic is climbing. Now, you really have to question why in some regions. I mean, if you can say, some of these African governments might be corrupt, some of these African governments, might not be reporting their numbers. The corrupt countries don't only exist in Africa. Corrupt countries are all over the world. Now, if there was really a pandemic level death rate somewhere in Africa, we would have heard about it. We would have heard about it in one of these countries where, I think the most severe one is South Africa. They have about 1,000. Let's look at South Africa so it won't look like we're ignoring that. So Northern Cape, okay, they have it broken up by province, but yeah, that one is almost 2,000. But again, almost 2,000, that is like, what we might see in 2 days from New York City or, a week from Chicago. So this is for the whole pandemic period. So, very interesting, very interesting. We are seeing the fact that maybe our modern healthcare systems, like we were talking about at the beginning of the show, about defunding the police, about having autonomous zones, about taking care of ourselves and our communities. Maybe when it comes to healthcare, we really need to look at some alternative situations and start looking back to some of our original cultures, the world's original cultures, to where we can find solutions instead of looking for or waiting for vaccines to come out or some government authorized or government sanctioned treatment to be released. Let's really, question, does our modern system have what it takes? Because as we just saw in the video, Nabahirita was explaining, the modern diet is really a huge part of the problem that we're facing right now. All the sugar that people are consuming is breaking down our livers, breaking down our resistance to disease, because our body becomes in a compromised state, and you have all these diabetic issues, cancers, all type of things happening because of sugar and other things in our diet. Now, these pre-existing conditions are what everybody knows has been credited as the reason why we are having these type of problems. why so many people are dying. Like most of the people who are dying from COVID-19 are dying with these pre-existing conditions. But instead of the pre-existing conditions, the pre-existing, we'll say, failures in our healthcare system, because if it's healthcare, they should be helping people care for their health. So the healthcare system is already failing, and then we turn to that same healthcare system and say, cure me when we have COVID. And we've released a couple of different videos already to show nurses coming out and exposing the rate at which people are dying, more so because of the problems with the hospital care, more so than the disease itself. That, to me, really the problems in these hospitals is the real pandemic that's the threat to human health right now. Stay tuned with us, because we are going to be releasing pretty soon a new video, it's actually it'll be new to our station, but there's a interview with a nurse in New York, giving a very detailed account of her experience in this New York hospital, and we're going to be posting that on our page shortly, so stay tuned for that. If you don't know the page, Meridian World News, check us out at MW News 2020 on Facebook, facebook.com/MW News 2020, and subscribe to the page, and you'll get the updates when they come up. Subscribe and follow the page. So our next topic today, continuing, more so with coronavirus, we're seeing the continued hysteria, and then the outright hypocrisy nowadays, because you saw when the George Floyd protests were going on, you didn't see any of the mainstream media coming out and saying these people are irresponsible, they're going out without masks, there's protesting, they're not social distancing, there's going to be a huge outbreak of new coronavirus cases coming out, even though every time you hear about, they open up the beaches in Florida, watch out. They're relaxing the social distancing rules in Chicago or in Indiana or what have you. Watch out. Movie theaters back open. Is it going to be safe? And even now, Trump started his re-election campaign this past Saturday, and the media was slamming him for having a rally for his re-election campaign, and yet they slammed him for potentially putting people's lives at risk, and then at the same time, you're not considering people's lives being at risk when they're going out to protest for the death of George Floyd. But if they're protesting for other reasons, like protesting lockdowns, then they're criticized for, again, breaking social distancing rules. So the hypocrisy is really obvious. And, it's not to say, we should support one or the other side. It's just like, if you using that logic of, okay, maintain social distance should apply across the board. You can't just be selective about it and say only for, these certain set of protests, we're not going to say anything. We're not going to criticize people. We're not going to call them, risk takers or what have you. It's very, very hypocritical. And so we should be very, skeptical of these kinds of media outlets that will blatantly contradict themselves like this. Like, the agenda that they want us to follow, they clearly have an agenda. If they're not, they should be honest. If not, they should be the same criticism you give to Trump, you should give to George Floyd protesters or anybody else. Now, the big question now is, these protests happened, the riots and looting started at the end of May, May 3rd, 29th, 30th, 31st, those days. And protests even started before that. George Floyd was killed on the 22nd. The organized protests had started soon after that and gained steam over the world. and especially, of course, in the United States. You know, huge protests lasting for days and still going on, like we can see in Seattle's autonomous zone. Let's look at this. Now, if you have this level of huge protests combined with the fact that many states are now opening themselves up, you know, starting business as usual. And I've said already, where I am in Indiana, there are now many places where you can still go. You can now go eat in at restaurants. You can now have gatherings of up to 250 people. Pretty much everything but like the county fairs are back up and running. Everything, and you can even do sports. You can go out and play a game of football, whatever you need to do. Everything is pretty much open. The summer programs are open. Only thing is now it's summer break, so you don't have schools. We're still waiting to see on that. But this has been since last month. As we know, Florida was opening their beaches up as early as April. And so again, Florida's in the news being criticized as for, you know, maybe they're calling them being irresponsible. They say that coronavirus cases are up, hospitals are filling up. Let's look at this news article from Newsweek. So multiple hospitals in Florida run out of ICU beds as coronavirus cases spike. Now, this will make you think, oh, the coronavirus cases are spiking in the whole state of Florida, and there's many hospitals running out of ICU beds. First of all, it's not unusual for a hospital to run out of ICU beds. Usually they only have a handful, maybe 10 or 20 or something like this. You know, in some of the hospitals where the infections have gotten out of control and they have all COVID hospitals, they turn the ER into ICU. They turn, you know, they put ventilators everywhere. You know, so just to say the ICU beds are filled up is not something special. It's not something unusual in a regular situation, let alone in a pandemic. But what they're calling multiple Florida hospitals is two hospitals. Two, multiple meaning more than one. So the lowest multiple number would be two. Two hospitals in Miami-Dade County. You can look this up on Newsweek. Two hospitals in Miami-Dade County ran out of ICU beds. And they're putting this kind of clickbait headline for us to panic over two hospitals running out of ICU beds and beds in Florida beds in Miami-Dade County being at 75% capacity. Guess what? Hospital beds are supposed to be at least 75% capacity or more. There's even a panic in the medical community amongst medical professionals of people having to fight for hours because they're getting furloughed indefinitely without pay. They're getting, you know, put on unpaid leave basically because there's not enough work. There's not enough people in the hospital. So to say, oh, 75% capacity, you know, what are they trying to do here? You see, there's clearly an agenda at play in these news sources. Let's look at another article. Within China, they say nightmare. What is it? Let's look at this new headline from China. China locks down all schools as terrifying second wave strikes. What is this terrifying? And this is from June 16th. What is this terrifying second wave? This terrifying second wave is the total of new transmissions from June 12th to June 16th or June 15th, 79 new cases. 79? If the United States, all of a sudden we woke up in the United States and we would say 79 new cases in 4 days, you would say, oh, the pandemic is over. But here they're saying terrifying new second wave is hitting. See, this is why you need to make sure that when you look at a headline, click, read the article, please, on social media. Stop liking, sharing, commenting on stuff, and you didn't even read it. You didn't pull up the video and look at it. You're commenting on stuff and you don't know the actual content, because this is totally misleading. A terrifying new second wave. How do you even call that a wave? You might say new infections in Beijing, you know, maybe start fears of a possible second wave starting. It's the potential start of a second wave. At best, you could go that far. But I don't see how you know, somewhere in your mind, you go 79 cases is a second wave of a pandemic infection in the country, even in the city. Beijing, do you know how many people are in Beijing? How many millions of people are in Beijing? I don't know. But I would say it's definitely more than New York or pretty much most other cities in the world, because you know how populated China is. Beijing is the capital. But don't take my word for it. Go look it up, please. Let's look at the United States. Let's look at the United States again. We have in the United States this scare. You know, many people have lately been talking about sharing, new cases are on the rise, new cases are on the rise in the US, new cases are on the rise after these states are reopening, new cases are on the rise after these protests, because of Trump, new cases are on the rise. Somehow it's all linked back to him and his fault. Let's look at this chart. Okay, because this is from Wikipedia. Again, very easy to find. Wikipedia.com. Just type COVID-19 United States Wikipedia. Boom, you're in there. Now, with this chart, you can see daily from the beginning of the pandemic, and we've only gone back as far as May, but you can see daily with the pandemic the increases in new cases and new deaths on a daily basis. And if you go back to mid-May, you're seeing an increase in between 1% and 2% in the number of, on average of 1% to 2% on the new cases and new deaths. Mid-May, early May, increases of 3 up to about 3%, sometimes 4% new deaths and new cases. By the time you get to June, now we're down to below 1% new cases and new deaths. And if you look at June, you look at the last couple weeks, I mean, we're under 1% every single day of new deaths. We're just, we're around 1%, on average 1 to 1.5% new cases per day. Now, what about this says that the United States cases are spiking? You see, that look for the data yourself. If people are throwing around data, and mind you, now, once again, there's all types of problems with this data. Cases are being exaggerated astronomically. Nowadays, many doctors have reported very unusual procedures on how to categorize a death after the fact, how to categorize it. Is it COVID related death? Is it COVID the cause, or is COVID related? And if you look at some of the data that you'll see, like coming from the CDC and other sources, they'll say COVID related. It's not going to be COVID caused. They say it's COVID related because the person had COVID. Now, what do you blame as the actual cause of death? It's really kind of an arbitrary thing. And you see they bend the rules with these things. Even if you if you looked at the map that we were looking at before, and you looked at some of the countries, like I kind of was tickled looking at Tanzania, because Tanzania said they said they had 500 cases and about, I don't know, maybe about 50 deaths. I'm just saying, could have been more, a little more, a little less. It was somewhere in the double digits. But let's just say, you know, if it was 50 deaths, 500 cases, then by the math that they were using to project their models of how many people they're saying are going to die from the pandemic or how deadly the virus is. Oh, Tanzania, 21 deaths, 509 cases. So even by that number means 4% of people who get it die if you use that model. If you say 4% of people who get it die, that's like a pandemic. That's like where you can say, oh man, it's a global health emergency. But yet somehow it's 21 deaths over the course of what, 4 months? So do you call that a pandemic or no? Or, you know, at best maybe 3 months since COVID has been definitely in Tanzania. Tanzania, very interesting, also the same place where they tested fruits and animals and other stuff positive for COVID-19. So again, when people are giving you data, it's very important to question, because what we're seeing now, people are using kind of like you know how you say first impressions, whatever your first impression of a person, you always look at them as that first impression. And our first impression of COVID is, oh snap, there's this, you know, super virus going around killing people all over the world. Look at Italy, look at New York, all of these places. And it's a huge crisis that we're all having to brace ourselves for. And so now all you have to say is, oh, new COVID case, and everyone's like, oh no. It's like, oh, you're gonna die. No. If you look, you know, again, some of the data is suggesting, you know, some of these tests, and again, we showed this in previous episodes, of the fact that some of these tests are testing for antibodies, and if that antibody test is accurate, then you're looking at, you know, there's many more people who tested positive for the antibody than what we have testing positive for actually having the virus in real time. And so the virus may kill 0.5% of people, meaning 5 out of 1,000, or maybe, you know, even less. So depending on what numbers you're looking at. But again, the main factor here is health. What is the person's health condition? And then once they get to the hospital, what is the treatment that they're getting? These are factors that people are not talking about when saying how deadly the disease is. So is the remedy for this disease continuing to keep us in our houses, or is there a better idea? Because obviously, the longer we have to stay home, it's really affecting people's lives. People are, you know, people don't have their jobs. They're not able to go get their goods, you know, but especially people not being able to work. Now, if we're in a state of being where you don't have to work to survive, you know, and pay your bills and stuff like that, if you don't have to pay rent every month, you know, like if you're in a place where you're more free, like say Africa or other indigenous places, then you can get away with not working, or not working a job for money, you know, even if that means you still have to work your farm and grow your food, you know. But since we're in a capitalist society, you need capital to survive, and people not being able to earn money is creating huge problems. People not being able to go out and unwind. People are dealing with all types of depression, severe anxiety, and all types of other problems. And meanwhile, there's no sign that these lockdowns are slowing the spread, because even places are opening back up and the spread is slowing more. It's not increasing the amount of spread if you just look at the data. So what are we really dealing with here? You know, question whatever your first impression of the disease was when you started hearing about Italy, started hearing about China. Question that, because those first impressions can obviously be wrong. And so please, let's continue to look. I mean, I'm saying the same thing I've been saying the whole time. You know, I have never been convinced that this is really the global health emergency that people are saying. Now, if you disagree with that, where's the data to really prove me wrong? Because if you don't have the data, you don't have the reliable information. You know, maybe it's time to question what the real agenda is behind these, the way the media has presented everything to us. We're going to go look into a couple other things here before we end up our broadcast for the day. This article came out in CNBC, an article plus a couple of videos released by the WHO, aka the World Health Organization. You know, the one that's supposed to be, the authorities on health globally. There was one video came out, a scientist from the WHO was giving some data and saying that asymptomatic patients of COVID are not the ones really driving the spread of the disease. Not to say that they can't be contagious, but they are not the main ones spreading the disease. Let's look at this.
We hear from a number of countries that X percentage of them are reported as not having symptoms, or that they are in their pre-symptomatic phase, which means it's a few days before they actually develop severe symptoms. In a number of countries, when we go back and we discuss with them, one, how are these asymptomatic cases being identified? Many of them are being identified through contact tracing. And so, which is what we would want to see, in that you have a known case, you find your contacts, they're already in quarantine, hopefully, and some of them are tested, and then you pick up people who may have asymptomatic or no symptoms or even mild symptoms. The other thing we're finding is that when we actually go back and say how many of them were truly asymptomatic, we find out that many have really mild disease, very mild disease. They're not quote unquote COVID symptoms, meaning they may not have developed fever yet, they may not have had a significant cough, or they may not have shortness of breath, but some may have mild disease. Having said that, we do know that there can be people that are truly asymptomatic and PCR positive. The second part of your question is what proportion of asymptomatic individuals actually transmit? So the way that we look at that is we look at these individuals need to be followed carefully over the course of when they're detected and looking at secondary transmission. We have a number of reports from countries who are doing very detailed contact tracing. They're following asymptomatic cases, they're following contacts, and they're not finding secondary transmission onward. It's very rare. And that much of that is not published in the literature. From the papers that are published, there's one that came out from Singapore, looking at a long-term care facility. There are some household transmission studies where you follow individuals over time and you look at the proportion of those that transmit onwards. We are constantly looking at this data, and we're trying to get more information from countries to truly answer this question. It still appears to be rare that an asymptomatic individual actually transmits onward. What we really want to be focused on is following the symptomatic cases. If we followed all of the symptomatic cases, because we know that this is a respiratory pathogen, it passes from an individual through infectious droplets. If we actually followed all of the symptomatic cases, isolated those cases, followed the contacts and quarantined those contacts, we would drastically reduce. I would love to be able to give a proportion of how much transmission we would actually stop, but it would be a drastic reduction in transmission. If we could focus on that, I think we would do very, very well in terms of suppressing transmission. But from the data we have, it still seems to be rare that an asymptomatic person actually transmits onward to a secondary individual.
So, as you can see, this researcher was very, detailed and specific about what she was saying, what they had been seeing, cases they had been following in different countries. Now, maybe the next day after this report came out, there was a counter report by the WHO saying that, wait, no, let's just go ahead and watch the video.
We know that people who are asymptomatic or pre-symptomatic, when we do nasopharyngeal swabs on those people, they're shedding in many cases as much virus as someone who's infected and symptomatic. So you could surmise from that they're going to be contagious. It might be the case that they're less contagious, but it's way too early to conclude that. We don't have definitive data on this question right now. So we need to assume that asymptomatic individuals can pass on the virus, because when we swab them, we know they have virus on them, and we know that they can exude it.
The majority of transmission that we know about is that people who have symptoms transmit the virus to other people through infectious droplets. But there are a subset of people who don't develop symptoms. And to truly understand how many people don't have symptoms, we don't actually have that answer yet.
So you can see, basically, apparently she, after making her comments, was forced to say, oh, it was based on a very small subset of data. Now you have this guy from the FDA coming and saying that you can assume that because the person has tested positive and they're shedding the virus or whatever, that they are contagious. We don't have the data, but you know, you see nothing in the second video was based on any actual data at all. There was no data, you know, talked about in that whole video. You see, what is the agenda here? Again, it's like anything that goes to show or goes to say, you know what, COVID might not be as big of a problem as you think. You know, now your video might get blocked on YouTube. You mentioned certain things related to COVID-19. Your video might get blocked on Facebook, Twitter. You know, there's censorship going on about that. And you can see the media outlets, as always, as they always have, as far as I can remember, are always slanting whatever is being presented in a certain, and presenting it in a certain kind of light. This has been going on for decades with all types of issues. All of us know better. We should know better than to believe just what the media is presenting to us. When you have this kind of contradictory information coming out, and then you don't go questioning, you know, what am I being led to believe and why? Then we're basically like sheep being herded towards the slaughter. Before we end the show, we're going to talk about a couple more things. First of all, with regards to masks, you know, a lot of people are coming, you know, I mean, let's face it, a lot of places are even requiring masks to be worn. It was a big issue when Trump had his rally and they didn't require people to wear masks to be at the rally. Here in Indiana, masks are not required to be worn, but right across the border in Indiana and Chicago, you can't go into a store, you can't go into public places without your mask on. This is, you know, interesting because there's no scientific data to say that wearing masks prevents the spread of the virus. I don't see where anyone has presented this scientifically. They just say, oh, logically, the droplets are not spreading because your faces are covered. You know, but the effectiveness really is debatable. Let's go look at this is from MSNBC, talking about not in MSNBC but just MSN, talking about these viruses, these masks and some of the side effects, potential side effects of wearing the mask long term. So you've heard of coronavirus. I'm just going to read through this. Slide 2. Number 1, shortness of breath and lightheadedness. Activities that result in the expulsion of air, such as talking, yelling, singing, and exercising, can result in the accumulation of carbon dioxide between the face and the mask, says Dr. Lily Barsky, That's a doctor, you guys. These symptoms are seen due to an increase of CO2 levels in the body. Now, breathing over exhaled air that turns into carbon dioxide might make you feel dizzy. Now, the interesting thing is, you know, in this video that we'll be sharing shortly, maybe tomorrow, from this doctor in New York, she was talking about how a lot of the people who are coming into the ER there and getting tested for COVID are coming in because they're having these kind of symptoms, you know, shortness of breath, you know, respiratory issues. What if some of these people, I'm not going to say all, I'm not going to say most, but what if some of these people really are just experiencing the symptoms of wearing a mask too long? After I've seen, you know, we've seen a lot of people walking down the street with masks on, driving in their cars with masks on. I don't understand why, but I guess people feel like you can get COVID in your car with your windows up and no mask. So, very interesting. If a disease is airborne, that means that it doesn't always follow spittle. It can just, you know, moisture by itself can escape from the mask. It can penetrate the mask. So let's look at the next slide. Headaches. Long-term wearing of masks can result in prolonged and repeated episodes of headaches. Next one. Acne. Re-wearing unwashed reusable masks or re-wearing disposable masks can lead to exhalation of dust, pollen, etc., that get trapped within the mask material, causing acne. Number 4. Chronic dermatitis. In the case of surgical masks, the non-woven fabric is made by using chemicals to bond the fibers together. Now, this brings up a interesting issue. Okay, if those chemicals can irritate your face and give you a rash on your face, those same chemicals, you will be breathing those chemicals in through the mask when you inhale. Therefore, anytime you wear a mask, even if you break out on your face or not, you got chemicals going into your lungs. Again, increased amounts of CO2 that you're breathing, synthetic fibers that you're breathing. You know, again, if you're just wearing your mask real quick to run in and out of the store is one thing, but some people have to work all day with their mask on. Like, there's no option for them. And then what are they doing to their lungs in those cases? And we've had, you know, I've heard people testify that them in their workplace, everybody's complaining about problems, shortness of breath, and so on, because they have to wear masks all day. Number five, weakened immune system. Now, weakened immune system, as we can see, you know, by the pre-existing condition, people with pre-existing conditions being so much more vulnerable to this disease. Weakened immune system is the last thing you want if you're trying to protect yourself from a disease. It says there are studies indicating that low oxygen levels in tissues, hypoxia, can suppress some aspects of the immune response. Let me say this one more time. Hypoxia is the exact thing that the doctors in the hospitals look for when they're testing for COVID, when they're testing for should we put somebody on a ventilator. They're testing oxygen levels. They put a little thing on your finger, they test your oxygen levels. And if you have hypoxia, hypoxia, hypo meaning too little, oxygen, low oxygen levels, as it says right here. You know, if you experience low oxygen levels from the mask, that can look like COVID to the doctors. Very interesting. Scientific investigations have proven that a prolonged denial of enough oxygen in the body can cripple the ability of our immune system to tackle infections, which is even worse with older and younger people, meaning children. Okay, number 6, skin wrinkles. Well, we're gonna just skip this one. Who cares about wrinkles when it's life or death already? Number 7, development of chronic respiratory conditions. Again, COVID-19 is what people are wanting to avoid because it's a chronic respiratory condition. However, in the case of the surgical masks, which are made of non-woven fabric, the exposure for some people can trigger an asthma-like inflammatory response in the lungs. This is likely due to the inhalation of the microfibers in the material that forms the mask. My gosh. So all these people being required to wear masks, all these people being required to stay home from work, all these people required to be self-isolating, not going outside, not going to the parks, not being around people. Are these conditions helping or are they contributing to the problem? And then again, when you go to the hospital, you can go to New York, and I hope once I post this video, you guys, I hope you watch it. Once we post this video of the nurse in New York, she's talking about how people coming into the hospital are experiencing shortness of breath and anxiety-like symptoms. They get checked into the hospital. They go directly into the ward. It's an all COVID hospital. Everybody there. They don't separate anyone who has COVID from someone who has not been confirmed to have COVID. So the people who, are sharing rooms, one person with COVID, one person without COVID, the one who doesn't have it apparently is probably going to catch it, you see? So, there's no lot, and this is in the case, the test that they were using in this video. Now, this video is from late April, but this was when New York had gotten really bad. And the tests that they were using at the time, they said they had 15-minute tests available, but because it's a public hospital and because they're trying to cut costs, they're using the same tests that take 3, 4, 5 days to get results. And meanwhile, the people are sitting in there waiting to get put on the ventilator so they can die. This is exactly what she was explaining in great detail in the video. Please watch the video. Okay. We just have a couple more things to get into. Recently, a few days ago, the province of Canada called New Brunswick had a vote to decide whether vaccines would be mandatory for children. Now, you see, different states and provinces around, these countries, US, Canada, which is almost like extension of US, and other places in the world are talking about these vaccines being the answer to COVID-19. So different places are starting to impose the vaccine requirements. So this is vaccines for school children. You will not be able to go to school or your child won't be able to go to school if they don't have their vaccine. However, this bill was defeated 22-20 in New Brunswick. Good, I'd say, good sign of victory for, because why should you be required by law to inject your child with an unknown substance? It makes no sense to make that the law, because technically those people who feel like vaccines are what are protecting their children from illness, if it's really protecting their children, they shouldn't be scared of children who get the disease. That's just common sense. Otherwise, what's the point of the vaccine anyway? Okay. In the UK, they have had a large problem with these protests continuing, and we have just from a few days ago, the protests became so bad, and they actually were defacing memorials such as the Winston Churchill statue. They had to cover Winston Churchill statue with a case, which is great. All these imperialists take their statues down. That's a great idea. If you want to do that to the Confederate statues, fine. How about the George Washington statues? How about all these other statues, you know, Winston Churchill statues? So apparently it was defaced. They really, you know, I'm not saying that's the main issue. There was a video on here I want to show. If you scroll down a little bit, wait, this might not be. It might have automatically went to the next one. But there was a video of some of the London protests and the confrontations with the police. As you can see with the photo, big protests happening in London as well. So London's response, they have created a new law in response to the serious and imminent threat to public health, which is posed by the incidence and spread of severe acute respiratory syndrome coronavirus. According to the government's website, it adds that in the emergency period, no person may participate in a gathering which takes place in a public or private place. A, outdoors, which consists of more than 6 persons, or indoors and consists of more than 2 persons. That's right, you cannot be in an indoor gathering in the UK of a gathering of more than 2 people. That means if you cannot have friends over your house. That means that if you can't go outside with your family, you know, depending on the size of your family, you cannot have a gathering 6 people outside and 2 people in the house. That is incredible. So this is really, you know, we're going to have to monitor this and see how this goes over in the UK. Will people really comply to this, or will they continue to hit the streets and protest? And if they do, what will be the result? Again, they're doing this in the name of public health, but at the beginning of the article, they're very clear that they said something has to be done about these protests that are going on. And it wasn't until the protests happened that they actually, you know, of course, introduced this ban on gatherings. Very awful things happening. And again, you know, when state of emergency is declared in these countries, unusual measures can be taken by the government authorities to do things, impose on the population measures that would not normally be acceptable to the population. Therefore, those who are in authority, you have to imagine that some of them are going to abuse that authority and do things that are detrimental to the public good. Here's another example. This ban on gatherings in the UK. All right, lastly, in Illinois, we have, you know, very interesting situation. You know, obviously a lot of people out of work that they found something for people to do now. What can you do? You can become a contact tracer. Get ready to work, you guys. Contact tracing is now a thing.
The city of Chicago is expected to hire 600 contact tracers at least $20 an hour. The governor says he wants nearly 4,000 in the state. So what will they do? Contact tracers are like detectives. They talk to a person infected with COVID-19 about where they've been, at work, the store, out in public, and who they may have come into contact with to try and get as many people exposed to COVID-19 to isolate and stop the spread.
I'm like, CSI contact tracing. This is gonna be fantastic.
Rhett Buckley is training online right now to become a contact tracer through a new program at Oakton Community College in Des Plaines.
You have to have a willingness to want to help people, and ability to communicate is always crucial. So if you're in like service industry, retail, a lot of those jobs that were really hit hard by the shutdown, this would be a great opportunity.
This is a role you can take on with no prior experience to help people where you live.
We're going to be hired in our community. You know, we're not being hired to make calls out in South Carolina. You know, we're going to be called to make calls in Lake County and Cook County.
Professor Kathy Kabai coordinates a new contact tracing training program at the College of DuPage.
It's like playing a clue game. So you're going to put together and you're going to be the investigator and solve the problems and figure out and try and connect the dots.
She says contact tracing teams in the state will be vital to stop the spread of COVID-19.
Knowing that you can help people, I think, is just neat.
The first course at Oakton is all full up, but they're looking to start a new one. The College of DuPage has openings that start in July. We've got a link to those resources and how to express your interest in becoming a contact tracer with the state of Illinois right on our website.
Watch your team in the morning.
Again, contact tracing. Stop the spread. Stop the spread. The coronavirus is killing people. You can help your community. They make it sound so nice, so friendly. Okay, but what about the people who end up having to get forced to quarantine or forced to leave their jobs? What happens to these people? What about the people who don't have regular income, get paid under the table, and you get forced to stay in your house? Then your landlord comes knocking on your door. I know you're in there. Where's the rent at? What do? You see? Okay, million people plus in the United States now infected, so-called infected, and this is active cases of people with COVID-19, or let's say active confirmed cases. That is not even including all the unconfirmed cases. It's too late. It's too late to now then say, oh, we're going to contact trace and get everyone to self-isolate. It's not going to, no, it's too late for that. That's all over. You're going to see, whatever the contact tracers that they hire, that's not going to stop the spread of the disease. It's not going to stop people from dying because of all these problems with their health and from the hospitals mismanaging their patients and putting them, on ventilators that are killing them. It's not going to stop all that from happening. But what it will do is it will create an agency within the government with the job to keep track of people. Like that will become the job to keep track of people and their contacts. You can watch one of our original broadcasts. It might have been the third or fourth broadcast. We were talking with a brother who was from China, or not from China, but he had lived in China and was there during the pandemic, and how talking about how much the government really was imposing on the people, and restrictions on people based on, who they had been around. Like he said, he had gone to the airport, and then when he got back, his status had gone from green to yellow on an app on his phone, and therefore he was not allowed to, go anywhere. He had to end up somehow getting himself a new phone with a new app with a new green status to just get out of the country, which he had been trying to do for at least a month. So the contact tracing, when it gets down into the technology, tracing who you've been around on your phone, the video didn't get into all of that, but that is part of what is being done in other countries. And you can imagine that's going to also be included here. Then once they get that information, they can, of course, come to your door and say, look, we see you've been around a person with COVID, you're going to need to stay inside, Contact tracing, a good thing? I'm not so sure. But I can see it becoming, because we see that this government, that these, large corporations, Facebook, Google, they're really, really, really putting more and more effort into keeping track of what everybody is doing. It's very clearly happening. It hasn't started with COVID, but it's being advanced now with COVID. Where this is going, I'm not so sure. But again, if we don't ask questions and we don't really see where, something that's really not necessarily or probably not even helpful is being imposed on the public again. And we're going to see there might be a much different reason for it than what's being stated and told to us on the news. This same news that is always lying to us, as we know. So, again, this is Meridian World News. Here we're committed to telling you guys the truth and exposing you guys to the truth. And at the very least, not telling you guys something that's going to make you feel good but not be true at all. My name is Perspecive. If you watched this whole broadcast, thanks for watching. We appreciate your support. Please make sure to like and subscribe and share these videos so other people can benefit from the information. All right, you all take care and have a good rest of your week. We'll be back again next Monday.